Hi, it's Jessica DaMassa with WTF Health. I'm here at the HISA studio, and joining me right now, I have Mark Brommeyer. He is the chair of the CHIA board. And so, like usual, I love a good acronym here in healthcare. So Mark, what is CHIA? What does that stand for?
CHIA is the certification for health informaticians for Australasia. So it's actually about looking at the competencies around a framework for 6 domains for health informaticians, because we're a very broad church. So across clinicians, technologists, policymakers, researchers, academics, what does that mean in terms of those digital capabilities that we need to be able to actually function in healthcare, and how best we can manage our information electronically in healthcare better?
Okay, and so defining those different domains, the 6 different domains, what does that mean exactly? Like, what types of things are you looking for here? I mean, this is obviously like a workforce training initiative here in order to credential and provide a certain caliber of, person. So what exactly are you looking to do with that?
Across health informatics, because it's such a broad church, there's a range of domains or areas of expertise or competence that we should have. So the 6 areas cross a whole range of areas, from information sciences to the technology domain to healthcare itself, biomedical, to core competencies, thinking about where healthcare and informatics sit within a social construct, within a legal construct, and then a whole range of management competencies that fit around that as well.
Okay. And so this is, as far as the CHIA is concerned, how is this credentialing program growing?
Yes.
Talk to me a little bit about that, because I feel like talking about workforce training, particularly here at HIC, has been just dominating the conversation. So tell me, from your perspective, as the chair of the board of the credentialing organization for this, what types of things are on your radar in order to help kind of prepare this growing subsegment of the workforce? What are you planning to do to help enable that?
So I think, importantly, CHIA is benchmarked against a whole range of international competencies in health informatics from America, Canada, the United Kingdom, etc. So looking at what are those various skills that we require to manage information better, make better business decisions, clinical decisions, etc. Across healthcare. And in terms of the future, so it's been going since December 2013. We're going through a review at the moment to look at the currency of those domains and the 52 competencies that sit within those. I'm also undertaking my PhD looking at health informatics competencies for a subset of the population, being health service managers, so people that manage healthcare, primary, secondary, tertiary, all sorts of managers of healthcare, doctors, nurses, policymakers, financial, operational, technical people, to make sure that the digital skills that we require to run the healthcare today and tomorrow are relevant and pertinent to actually helping us balance our budgets, deliver good healthcare, and get those outcomes that we're after.
So I know you're just undertaking your work on your PhD with this, but I'm curious, do you have a hypothesis about what you might find as you're going through your research?
So mine's really about asking questions about the current CHIA framework that we've got that's going through a review, so good timing in terms of that research. What are those informatics competencies that managers in healthcare need? There'll be a subset within that. We've got some management competencies already defined, so I've got a acute interest in that area. Then thinking about, we have a framework in the Australian College of Health Service Managers as an example. So that recognises a range of competencies under domains as well. So what are the informatics competencies in there? So initially what I want to do is put the two together, look at what the bit in the middle, like the old Venn diagram, look at the bit in the middle, what that means, then start asking some questions around the relevance of them. What does it mean in terms of the health service managers themselves? What skills do they think they need? And then how do we reflect that back into the workforce as health informaticians?
Would you say, just anecdotally, because I know you're not through your research at all yet, but I mean, as you've been around with the CHIA credentialing, and now, I mean, I feel like so much has happened just in the last 5 years in digital health. Like, just the last 5 years, I feel like have just been just monumental in terms of shifting things, and just the uptake has been a little bit more broad scale and ubiquitous, like around the world. So, I mean, do you have any guesses about things that might need to be updated, like what's missing completely, even from the competencies that you've already identified as part of the core of the training program?
Yeah, good question. I think that the basics are there. Because healthcare and technology changes so quickly, there's certainly areas we're seeing rising in terms of data analytics. So how do we best use the data that we've already got, because there's exabytes of this stuff electronically available available in healthcare, how can we help our managers and other people making decisions with the information, our clinicians, etc., to make better decisions with the right data, electronically bringing that together to form information. So what are the skills in presenting data electronically, make information come to life? So language we use now is around actionable insights. So how can we use the electronic tools, reflect that data, the analytics of it? So that's a big area to help make better decisions electronically. Presenting that data visualisation is important. Another big area in health informatics is artificial intelligence, both in a clinical setting, in a research setting, in a technical setting, etc. Important things there probably we need to think about is what are the key components of good, successful artificial intelligence to help us manage our business, be it business or clinical issues, particularly then thinking about what are the ethical challenges we face, what's the evidence base, because artificial intelligence is a new therapy, if you like, in terms of healthcare. So putting it in a context or a model in society and being able to think about, as all these new advances come through, how do we balance that? How does that help us balance the healthcare budget? How does it help keep people out of hospital? All that sort of stuff.
So as this discipline, I mean, the whole health informatics area, I mean, it's really where health and technology come together, right? So I wanted to ask you, you know, there's two ways in, right? You can either come in through the health background, or you come in through the technology background. So what is often, from one side or the other, the competency that is most overlooked? Like if someone were to ask you, like I'm a clinician and I'm in health and I want to get more into the technology space, what competency do you recommend they work on? And vice versa, from somebody who's on the tech side, what's the thing that they're often missing or that they should look at from what you've experienced to grow that competency to be able to work in healthcare effectively?
Another good question. I think the third party we need to put in there is our managers. So we've got our clinical colleagues, we've got our technical colleagues, and we've got the management colleagues that may come in from a management science, financial, governance, whatever the case might be, not clinical or not technical specifically. So the three groups need to be able to communicate together. So what I always contend is that if we know what are the business or clinical issues that we're trying to address in healthcare, that covers a lot of what we try and do across the spectrum of delivering healthcare services. What then is the data that we need to turn into information to give us the knowledge to make the decisions about those clinical and business issues? So when I lecture in health informatics, we get clinical colleagues, technical colleagues, management colleagues, researchers, etc., is getting them together to start speaking a common language to understand a bit about the clinical if they're technical, a bit about the management if they're technical, and vice versa across those three domains, and then position that within the framework. And that's where CHIA is really nice, because that balances out that broader framework about health informatics sitting within those different domains or disciplines that people come into health and health informatics with. But we've got to manage our information better electronically in healthcare. We're running out of money.
Well, okay. Do you have any suggestions for how that happens?
Again, there's huge amounts of data and stuff already there. We had some wonderful examples already in the conference, HIC 2019 to date, about people actually talking about the data that's available and how we can use tools that are clinician, consumer, management friendly to actually start extracting that data to better use the information to make decisions. A lot of what we need to know is already there. We've just got to be able to get the tools to unlock it so we can start making those decisions rather than just assumptions. We need an evidence base, and health informatics can help us provide that.
There's a doctor I've interviewed in the States called Atul Gawande, and he talked about how medical data, hospital data, is the most expensive data that you can have because you have an MD entering it in, but yet it is often the least utilized data in the healthcare system. So it sounds like you and he might get along pretty well.
I think the important thing also is we want to keep people out of hospitals. So when we think about, spending $1 in primary care versus $100, in intensive care, how do we keep people from that shift? There's so many changes now in technology, the wearables, the Internet of Things, consumer-led. Standard 2 for our National Safety and Quality Healthcare Standards is about consumer engagement. So we've got all of these wonderful devices now that we can use to help keep ourselves well, keep ourselves out of hospital. How do we actually start reflecting that better, having consumers driving some of those policy conversations that will actually affect the funding conversations and keep people out of these expensive palaces of illness.
Is the better trained workforce the answer to that, you think? Is that the silver bullet?
It's part of the silver bullet. The other part is consumer health literacy. We've got people that are more digitally literate. I've got 3 daughters. They all use iPhones. 2 are studying nursing. They just expect that everything's going to be delivered on their iPhone.
Right.
So we're seeing a shift in that consumer health literacy in terms of technology, and particularly our chronic disease management groups are a really good example of sharing electronic information within their group using the tools that are available, the mobile phones, the chat groups, all that sort of stuff. How do we then harness that information? One last thing that also strikes me is if we think about data analytics, artificial intelligence, etc., one of the growing areas now we need to think about, because we can map genomes to electronic medical records, how do we bring in that environmental data about what we've experienced in our environment and what that means to our healthcare as well? I think that's a big area we need to
Now,
pursue.
when you say that, are you talking about like the smart refrigerator that knows how often I go in there, or are you talking about something different when you talk about environmental ambient health?
I didn't think of that. That's really important because we need to look at keeping people well. So how do we prevent disease? Those social determinants, the refrigerator, the talking refrigerator will be a part of that.
Get out.
Exactly. Put back the Mars bar. But the other important thing is also the environmental thing, the exposure that we might have seen. Things from the asbestos to all of those things
so
in the
you really
environment.
mean environmental.
And that's where we've now got a lot of data that we've collected. Bureau of Meteorology, for example, has got a huge amount of data about the environment. I don't know the answer, but if we're starting to collect electronic data, bringing that together as information, and we want to start looking at predictive and prescriptive analytics for our population, be they patients, consumers, whatever, how do we also factor that information in? Because that's part of the social determinants of healthcare.
Absolutely. In the US, and I'm not sure how it is here in Australia, but you can determine life expectancy by zip code, and it's off depending on which kind of socioeconomic neighborhood you're living in. In a very big way. Is that like that here?
We've got very good statistics through the Australian Institute of Health and Welfare, Australian Bureau of Stats, and a range of other, the Beach Report, all of those sort of things that can help us understand where you're going to be better off, worse off, access to healthcare, what that might mean. We've had different classifications of rurality and what that means to your healthcare, but the social determinants, how do we feed that more into this illness model that we've been in for the last 100 years? Now that we're electronic, how can we gather that data that people have got through their wearables or through environmental exposure data or whatever? I think that's a really interesting area to pursue.
Absolutely. And last question for you, and I'm curious to get your take on this because you've been very forthcoming so far with your opinion about the future of health. Do you feel that Australia is on the right track, especially with I've talked to quite a few people here about not only workforce preparedness, but also about my health record, and that being now opt out, everybody is opted in. And so now there's 90.1% of Australians have this electronic record. Is this the vehicle that allows that data that we're talking about? Is this the centralizing record for each patient that is going to have the capacity to do the kinds of things that you're talking about doing into the future? What do you think?
I think I worked with Anita, its former representation of the company that's now the Australian Digital Health Agency. That's certainly a part of the equation, because at least when we've got summary information about a person, we know their diseases, their current medications, their list of allergies, etc., things they've had done recently that will affect their healthcare, that will affect us in terms of making decisions when we're going to treat them. I think what we can do is think longitudinally about how we turn that into a lifetime care record, and then how we start feeding some more of that data in. I think we've got to get the basics right first. We're getting there. It's taken a long time. It's been 30 years in the making, $2 billion notionally that we've spent to get the My Health record to where it is. And as an old emergency nurse, that stuff's really important.
It is.
When people come in, we don't want to give them the wrong medicine or give them something that's going to have an adverse effect, when simple information availability will actually help deter that. Reduce costs, we can actually use that 10% of the budget to do other things. But being able to think about that longitudinal lifetime health record, I think is really important. And the My Health record I see is a really good start to do that. It's nationally funded, it's infrastructure, they've done the policy, the privacy, all of those things that we need from a legislative point of view. We're getting adoption and uptake through practitioners now, that's really exciting. And now we need to think about what's the next stage and how we can use that.
You're going to have to send over this PhD dissertation when it's done so we can have a read. It's been lovely chatting with you. I really appreciate you tying all of these disparate things together and kind of bringing us to a point of understanding about what's going on currently in Australia and also what could happen in the future. So thank you very much.
My pleasure.
Thank you. Thank you. I'm Jessica DaMassa with WTF Health here at the HISA studio at HIC 2019. Thanks for joining us.